Managing rosacea as skin ages. What changes and what stays the same? Rosacea is a chronic inflammatory condition that affects millions, typically emerging between the ages of 30 and 50. However, the battle against facial redness and sensitivity does not end there. As skin ages, it undergoes structural changes that can exacerbate rosacea symptoms, making previously effective routines feel insufficient. While the core medical treatment for rosacea remains largely consistent regardless of age, the supportive skincare regimen must evolve. Aging skin becomes thinner, drier, and more fragile, requiring a shift in how patients protect their skin barrier while managing inflammation. Why age matters for rosacea? The intensification of rosacea symptoms in older adults is not merely cosmetic. It is physiological. Two primary factors drive this progression. Structural decline. As we age, the production of collagen and elastin decreases. This thinning of the dermis allows blood vessels to become more visible, amplifying the persistent redness, erythema, and spider veins associated with rosacea. Barrier dysfunction. Older skin tends to lose moisture more rapidly. A compromised skin barrier increases sensitivity, making the skin more reactive to environmental triggers and topical products. We see more redness in rosacea with age because collagen and elastin decrease, allowing for blood vessels to become more visible. Explains Dr. Adekemi Akingboy-Harvey, a dermatologist at Johns Hopkins School of Medicine. Furthermore, Dr. John Barbary, a dermatologist at Harvard Medical School, notes that rosacea is a progressive condition. Features like broken blood vessels and inflammatory lesions can worsen over time if the skin's natural defense mechanisms are not supported. Core treatment, consistency over change. Despite these physical changes, the medical management of rosacea itself rarely changes with age. For approximately 95% of patients, the clinical approach remains the same whether they are 40 or 90. Treatment is dictated by the dominant subtype of rosacea, which includes persistent erythema, constant redness, papules and pustules, inflamed bumps resembling acne, telangiectasia, visible blood vessels, phimosis changes, thickening of the skin, often on the nose, ocular rosacea, eye irritation and redness. The key to success is identifying which symptoms are most bothersome and tailoring medication accordingly. However, while prescriptions may stay the same, the daily skincare routine requires significant adjustment to accommodate aging skin's new vulnerabilities. Adjusting your skincare routine to manage rosacea effectively in later years. Patients must prioritize barrier repair and protection. Here is how to rethink your daily regimen. Prioritize aggressive sun protection. Sun exposure is one of the most potent triggers for rosacea flares. As skin thins, it becomes even more susceptible to UV damage. Recommendation: use a broad-spectrum sunscreen with SPF 50 or higher. Why higher SPF? People often underapply sunscreen. A higher SPF provides a buffer against inadequate application. Both mineral and chemical sunscreens are viable options, provided they do not irritate the skin. Simplify cleansing. Harsh cleansers strip the skin of essential lipids, worsening barrier dysfunction. Recommendation: switch to soap-free, fragrance-free cleansers. Goal: cleanse without disrupting the skin's moisture balance. Avoid foaming agents that leave the skin feeling squeaky clean, as this indicates excessive dryness. Upgrade your moisturizer. Lightweight lotions may no longer suffice for aging, rosacea-prone skin. Recommendation: opt for thicker creams containing ceramides and dimethicone. Why? These ingredients help trap water in the skin and repair the lipid barrier, reducing sensitivity and irritation. Reevaluate retinoids. Retinoids, vitamin A derivatives, are gold standards for anti-aging, helping with cell turnover and collagen production. However, they are notorious for causing irritation and sun sensitivity. Two things rosacea patients must avoid. Caution: many dermatologists, including Dr. Harvey, advise against retinoids for rosacea patients unless carefully monitored. Alternative approach: if a dermatologist approves their use, apply retinol once a week in a moisturizing cream base rather than a gel. This minimizes irritation while offering some anti-aging benefits. Better alternative: Azelaic acid is often preferred for older patients with rosacea. It reduces inflammation, fights bacteria, and offers antioxidant protection without the high irritation risk of retinoids. The patch test rule: with an aging, sensitive barrier, the risk of adverse reactions to new products increases. Protocol: before applying any new product to your face, test a small amount on your inner forearm for several days. If no reaction occurs, it is likely safe for facial use. When topicals aren't enough, laser and light therapy for symptoms that resist topical treatments. Particularly persistent redness and visible blood vessels procedural interventions can offer significant relief. Intense pulsed light, IPL, and lasers. These therapies target hemoglobin in the blood vessels, destroying them to reduce redness. They also stimulate collagen production, which can improve skin texture. Efficacy: studies show that patients with vascular rosacea can achieve 50–75% clearance of visible symptoms after just a few sessions. When to consider: these are typically reserved for cases where daily skincare and medication fail to control symptoms. They are costlier and require downtime, so they are not usually the first line of defense. The bottom line: aging does not require a complete overhaul of your rosacea medical treatment, but it does demand a more gentle, protective approach to daily skincare. Focus on repairing the skin barrier with ceramide-rich moisturizers, protecting against UV damage with high SPF sunscreen, and avoiding irritants like harsh cleansers and aggressive retinoids. If your current routine no longer controls your symptoms, consult a dermatologist. They can help determine if you need to adjust your topical regimen or consider laser therapies to manage the visible signs of rosacea in aging skin.